Hello, welcome back. I hope you had some fun with the SI joint. Did you practice all three movements? Would you be able to figure out now from the next time in your clients what is stopping them, how and when to get the movements from the pelvic area, forward flexion, symmetrical rotations? I hope so, right? It's a practice time. So always practice, practice, and practice. And without practice, you won't be able to get it. So right, it is fantastic, mechanism to know actually that how you can prevent injuries and how you can get into your yoga asanas, right? All right, so now let us see something on the hip joint. So this is your hip joint, which is combination of your pelvic and the femur bone. So in the femur, you will easily see in the notebook, you will see all the details of how different shapes and sizes of the structure of your acetabulum and the structure of your neck of the femur, greater trochanter, length, and everything can create a lot of differences in your yoga asanas and why everyone feels different and does differently, isn't it? So here I will just tell you that how this structure, the hip joint, what is the anatomy of it. So as we know that the hip joint here having all the movements you must have gone through, flexion, extension, moving back, abduction is moving away from the midline of the body, adduction coming back, similar to the shoulder, all the movements, right? Internal rotation is when you're moving it inside, external rotation when you're moving it outside, right? External rotation, and then circumduction. You can move your femur bone into all direction, that means the leg into all direction. Here it is a ball and socket joint, just like your shoulder, right? But a little bit less vulnerable than the shoulder because shoulder is too much mobile. It is not too much mobile. In fact, it is too much rigid nowadays for us, right? We need more mobility in this area, isn't it? Right? So what people basically need to understand here is mostly people when they are unable to get flexion, full flexion, and you know why. Your mentor must have told you what is restricting you into the flexion. You remember we discussed in the SI joint about something in the asymmetrical movements should be coming from the hip joint. Yeah. So it should be mobile into flexion, into extension, isn't it? Similarly for the splits, when you're having the splits, so should be able to move the split, right? Completely. Well, now what gives you that limitation? First of all, muscles, is in most of us are super tight in the body only. We're unable to even explore that how this bone tension or the bone compression feels like. Because most of the time in the hip joint, we are super tight. So we need to work on it. But slowly and gradually, one day you end up getting this compression point, and then will be the time when you will feel that okay, there is no more room to go. Okay, that you will learn in the course, that how you will figure out that. But here, just understand the anatomy, that the acetabulum here, you will see the orientation of it, how it is open, how it is closed, and then how much is the length of the femur of femur neck, the angle of the femur neck, the acetabulum or the greater trochanter, how much longer, how much shorter it is, and then the shaft of the bone. Everything together, all together, defines that how you will look like. Okay, and forget about comparing other person. It is within you only. Your right side and the left side can be different. Okay, and on one side you are able to do certain things easily, on the other side you are not. It's completely fine, guys, because if it is biomechanical differences in the body, you cannot do anything about it. Yeah, till the time it is muscular, till the time it is related to your tension, please work on it slowly and gradually with time. Okay, in a right way. Good, no force, in a right way, right? So this is your hip joint, which can do many functions. You have to work for the mobility part here. Okay, keep it mobile, because you will see 90% of the yoga asanas are coming from the hip joint only, and that's how you end up getting the trouble, that you're unable to do those movements, and then your other joints are getting the trouble, like knee joint and the lower back, isn't it? So create some mobility on the hip joint. All right. So this is the hip joint. If you have any questions, please feel free to ask your mentor, and the mentor will take you through all the movements of the hip joint with your asanas practice. Okay, here is your pelvic hip joint. Keep practicing. I will see you next for the knee joint.